Welcome to the Setiba Medical Spa podcast. Setiba Medical Spa offers aesthetic and wellness services located in Westlake Village, California. We offer state-of-the-art treatments which are administered by our professional team of highly experienced and licensed practitioners.
Hi everyone, this is Emilia, CEO and founder of Setiba Medical Spa. Welcome to our this week episode of Setiba Medical Spa. And today we have Quinn Luster, our physician assistant and head of our office.
Hey everyone, I'm Quinn. I'm the PA at Setiba, and we're just going to be chatting about the treatments and some services and how to get the results that you all want to get. Yes.
Of course. Quinn, tell me a little bit about your background.
So I went to LMU undergrad, which is in Los Angeles, and then from there I was always working in a dermatology clinic. I was always working in aesthetics. I fell in love there with the world of aesthetics, and then I further applied to Indiana for PA school, was accepted, and then I kind of based my education on building my foundation. So I went to a plastics rotation, a dermatology rotation, just kind of encompassed all of aesthetics so that I would be prepared for when I became a physician assistant a little bit more. And then I started working at Setiba and fell in love even more with aesthetics and what I can do to help patients, and just a fun field. It's great to see patients happy, and I thought that was just great. I love medicine, but I think this form of medicine is a little bit more fun than just a hospital or a regular clinic, per se.
Of course. It's aesthetics.
Yeah, everyone's happy. And if they're not happy, they're going to be happy leaving the office, which is great.
100%. So you always had passion for cosmetics and aesthetics.
Yes. So I didn't know I had the passion until I started working at a dermatology clinic, which I thought was going to be straight dermatology. And it was 50-50, which was great. So I got to see the aesthetics, the injectables, the lasers. And then I got to assist. I got to work the front desk. So I got to see the whole clinic and how it worked. And it was amazing.
So you're familiar with the whole everything,
yes,
A to Z.
Yes. It was very intense. The clinic was very it was fun, but it was very professional, and it was great because I got to see how the front worked, the back worked, how the office manager spoke to the patients, and it was amazing because then that only just kind of fueled my passion for getting further in aesthetics and getting to know how to really be in a clinic and how to make it a powerful one, which is great because your clinic is already amazing. So it was very easy to kind of walk into that and just kind of help it transform, and it's been amazing.
Perfect. So you know how to speak the aesthetics language.
Yes, which I think is huge. In aesthetics, I think it's a full anatomy of things. It's not just the basic words. It's when a patient walks into your room, instead of saying, "How are you feeling?" it's more of, "What is your concern today? What is your main focus?" It's a whole different arena, in my opinion, and the language is huge, and how to speak to patients and how to get them to their goals is huge, because not everyone has that background of where they want to go, and so you have to understand what a patient wants when they walk into that room.
Of course. Not everyone knows about all the cosmetic treatments.
Yeah.
So we have to educate them, correct?
Yes, there's so many. I didn't even know about half of them. So, I mean, there's so many new ones. I feel like we get introduced to a lot of new ones all the time, but our clinic has a good stacked machinery, a good bunch of new. I feel like we have the newest and the latest machines.
The best ones.
Yeah, which is great because I have a variety to pick from. If I treat different ages, different males, females, so it's good that I can offer different services to them.
Very good. Which one is your favorite treatment?
I think you can guess with that one. Which
Morpheus, eh?
Yeah, so Morpheus is great. It's kind of like our foundational treatment in office. So it's one of my favorites. I think it's a good place for a lot of patients to start. So it can range from the 30-year-old to the 16-year-old acne patient to the 65-year-old woman, and they all need a Morpheus 8 treatment, in my opinion. They can all benefit from Morpheus, which is awesome because I've never met a service that can benefit such a range of patients and clients and make them all happy.
What does it do?
So Morpheus is a microneedling RF treatment that will stimulate collagen. We recommend 3 because this isn't plastic surgery. I can get you happy with 1, but I want you to be over the moon happy, and we start with 3. So it's going to stimulate collagen. It's going to give you a lifting and tightening effect. And for acne patients, it's going to hopefully get rid of their acne because of the RF. So I can change the energy and the depths according to the patient. So every patient's different. If someone has heavy lower face, I can reduce that. If someone just has loose skin, I can get that tighter with that, just depending on the depth and the RF that I use, which is awesome.
So whoever who is using the Morpheus 8, they have to be experienced on what they do, correct?
Yes. So it's very provider dependent, which is interesting because I've had a few patients come in and they're like, I just don't see any results from the Morpheus. And I tell them, well, let's try it. Let's do it here and try it because it's very provider dependent. They can adjust the depth, the energy, and where they do those. So they have to know what energy to go up to, what depth to go up to get the result that that patient wants.
Of course.
Yeah.
Can they like melt fat on the face if they don't know what to do?
Totally. So, so if they have a heavy lower face and they want to fat reduce, then I will, but we don't, typically a younger face is full and we add filler to a face. So I don't want to melt fat into a face that needs filler per se. So I won't go into a deeper depth and higher energy for that patient.
All right.
Yeah.
Very good. And can you describe a day at Setiba? One of your crazy days?
Day at Setiba. Okay. I love the crazy days, which is, I know, funny to say, but I love when the office is busy. I love when I have a schedule that's full of Morpheus, injectables, lasers, what else? Like microneedling.
You do a lot.
I know, we do a lot. There's plasma pen happening. There's
How do you like the biotech treatment?
hormone replacement's awesome. So, I think it's very beneficial, especially for the female patient, which a lot of patients don't know they need it, but females love being on testosterone. It's awesome. It's going to make their energy levels high. It's going to help them sleep at night. Their libido is going to be up. It's just going to make them feel more alive, which is awesome for the menopausal woman that thinks they need estrogen, but they might need testosterone instead, which is amazing. And I do check all their levels. We get their labs in, and then we kind of focus on the areas that we want to optimize, and they feel awesome.
All right, perfect.
Yeah.
And how often a patient has to do that?
So the pellets last for females for around 4 months, for males 6 months, but it's honestly dependent on the patient. So if they come to me after 3 months and Quinn, I just don't feel it anymore, like I think I need to get repelleted, then we'll repellet. The frequency is based on the patient. The dose is based off of what I recommend, basically.
Perfect.
Yeah.
Very good. You did it for me, and I love it. Huge difference in like my sleep, my energy level, everything, day and night difference.
Yeah, that's awesome.
Thank you.
That's what I want to hear. Yeah.
Of course, everyone who comes and do it, they are very happy.
They are.
And I noticed they come back with their partners.
I know, which is awesome. That's great because everyone needs to check their labs, even if they think they don't. It's amazing. And what it can do to make you feel better, to sleep, is huge. And just your energy level and your libido's up. It's awesome.
When you do Morpheus 8, these days, everyone who comes in for a consultation, the first thing I notice what they want, it's like they say, I want to look like that. They want to tight.
Yeah,
it's like a facelift.
I know.
Okay, so we recommend them. The first thing is Morpheus 8. That stimulates the collagen with skin tightening. What treatments do you combine with Morpheus 8 to get to that facelift look that they want?
Yeah. So first, when I'm meeting a patient, I set realistic goals. If they want to get that facelift, first I tell them we're only going to get that facelift or that mini facelift if we do this amount of treatments. It's not realistic to only do one Morpheus and have that outcome. So I start with how many treatments we need to do. This is the kind of transformation you're going to get. And then from there, I go to what else are they kind of focusing on. So if they point to their under eye, then I'll pair that with an Agnes. Which is a similar treatment but more specific. So our Agnes is going to be a needle with RF that is specific for that area. So I can go in, get those fine lines, target them, make them extra tight under there. Or if they have eye bags, I can really hone in on that area, or the jowls, for example. And I will pair it with the Morpheus. So then there's also the injectables, which I can pair with. So Botox, in my opinion, we always need Botox just because it's a muscle movement. So Botox.
When you say Botox, just Botox, Xeomin, Juvo?
Sorry, yes. So I'm so used to they just tackle that arena with that name. But so we have Botox, and then we have Xeomin and Juvo, which are 3 brands that we carry in office. They are all neurotransmitters. So they're going to be working on the muscle. They're just different brands. So we carry 3 brands to offer our patients, depending on their preference, depending if we recommend something that's better for them, if they're younger, if they're older. So I pair it with their injectables for their upper face. So
basically, you make a treatment plan for them.
Correct.
Very good.
Yes.
Very good.
Yes.
So when they come in, it's not just one Morpheus 8 you do, get Botox and filler and be done with it.
Totally. So it's a journey. It's a fun journey with a patient because they can't just come in and do one treatment or one injectable and expect that outcome. They have to do a plan. We have to do a plan together. They have to have products at home. They have to do these treatments. They have to maintain those treatments, which is huge.
How important it is to use products at home, since you mentioned that.
Yeah, it's huge. It'll make a huge difference. People underestimate products. So if you're going to spend money in this treatment, in this investment, you need to spend money towards that investment with products, in my opinion, to help maintain that at home. A treatment's great, but if you can't do a little maintenance at home, you're kind of just throwing that treatment very quickly, a little speeding it up to have a new treatment, if that makes sense. Yeah.
When I do consultation with patients, I tell them, if you don't do at-home care, it looks like you go to a dentist and have a deep cleaning and go home, don't brush your teeth, don't floss, and 6 months later go for another deep cleaning.
Yeah, that's a perfect example. That's a great analogy. Which we brought some products to show you all. I don't know if...
Which one is your favorite?
Oh, I have so many.
Oh, actually tell me, what product do you have in your bag?
So I have the SPF always. I know it's probably the least expensive product you can buy, but probably the most important product that everyone should be having in their bag, reapplying all the time. That should be the first or the last product you put on before you leave your house, and the one that you carry with you. What do you have in your bag, Emilia?
Oh my God, I have a suitcase.
I
have a suitcase of products. I have everything from like vitamin C, growth factor. I deal with melasma, and I have rosacea. I have both.
Oh, wow.
So I use growth factor, vitamin C, eye cream, and...
What's your favorite brand? Do you have a favorite brand?
I mix and match my products. So I can say, for example, I would say for pigmentation, I love Zeo Bougie.
Totally.
It targets pigmentation very well. For dehydration, our younger patients, I love GM Collins.
Their intense moisturizer is awesome.
It's the best. The moisturizer is the best. Yes, and I love their facial products packages. Everybody who does their Collins facials, there are different ones. Everybody loves it.
Oh yes, the Diamond Glow is awesome.
How important it is? How the facials? How important the facials are?
So facials are extremely important. People don't realize that their skin's dehydrated or that it needs the extra love that a facial can do. It's definitely not a treatment, but I mean, per se as intense as a treatment, but people need the hydration. They need those pores exfoliated. They need that's maintenance. That's part of maintenance. It's awesome when people get, especially the Diamond Glow facial or the Collins facials, where they're more specific for the patient, where they can target that specific patient and what their needs are, which is awesome.
What is your favorite treatment for body?
So we have a few body treatments in clinic. I think the M-Sculpt is probably my personal favorite just because it's a fun one. It's no downtime, it's not painful. It's just your muscle contracting, which is awesome because everyone loves to be sculpted and have that muscle definition, which I know is hard to get in the gym sometimes. So this is a good addition to just if you're working out and you're not seeing that muscle.
Oh, it's a great addition to exercising.
Totally. I would recommend keep exercising. But
yeah, definitely. Do exercising, but you see better result if you add
yes.
the M-Sculpt to it.
Yes, totally.
It shows the
definition. Yes.
Definitely.
You just feel like firmer after one treatment even, which is awesome. We have the arms M-Sculpt. We have the abdomen. We have the glutes. We have one
the
more.
M-Sculpt.
Yes.
And then we have Exelis.
Exelis for fat reduction, which is just like a gentle, like a heat massage almost, which feels great.
Yes, it's all it's ultrasound and radio frequency together. Amazing for like fat reduction.
Totally.
And the other treatment we do for the fat reduction is Morpheus 8 body.
Oh, yes, which is awesome. So that's going to be in any area. So we can do it even on like back fat. We can do it on bra fat. We can do it on the abdomen, the inner thighs, which I love the variety that we can do it on. We can do it on any part of the body that a patient comes to me and is like, I need fat reduction, I need tightening, or I need both, which is awesome.
What other areas of like problem areas do we solve with Morpheus 8?
For the body?
Mm-hmm.
So we do the upper knees, which is a lot of female patients come to me and they're like, I have laxity here. I just want this tighter. So that's an amazing result right there. We do inner thighs. We do glutes, banana rolls. We can do love handles, bras.
Does it help with cellulites or?
It does. It does it all. It's like the mega body treatment in clinic.
So cellulite, stretch marks, fat reduction, skin tightening,
it
all
does
of it.
All. Yeah, so stretch marks are tricky, but the microneedling will remodel that stretch mark so that it will decrease it, make it smaller and shrink it, which is awesome. It's what a lot of females will come to me and be like, I have a bunch of stretch marks, I want them gone. So that's one of the foundational treatments we do for that.
Morpheus 8.
Morpheus 8 body.
The best treatments ever.
Yes.
What other treatments would you like to add to a Morpheus 8 when you do? For example, someone like me who comes in with a melasma and rosacea and wants to do a Morpheus 8.
Mm-hmm. So I pair it with Adva, which is our laser, and we can do it the same day. We can do it before Morpheus. It's going to help with your melasma, your rosacea, any pigmentation. It's going to brighten your skin up, which is awesome. And then I can do your Morpheus right after. So we just numb you for a little and then we do the treatment afterwards, which is key, fundamental. Or you can do the Adva solo, like a separate day. For like, say you have an event the next day, you can come do the Adva the day before. It's going to brighten your skin nice. You're going to make your skin tone look even. It's an awesome event laser treatment.
It's great.
Mm-hmm.
It's great.
Yeah.
Especially for the dark circles
Totally.
under the eyes. I love it.
Yes, and it's painless, no downtime.
No downtime.
Yes, so a lot of my patients love that treatment.
Because when right away after the treatment, you see the glow on your face.
Mm-hmm.
The difference, you see it right away.
Totally. Everyone loves the instant gratification.
One of the frequently questions when a patient comes in, as far as female concerns, what is it that they're asking?
So some females will come and ask about incontinence or vaginal dryness, and so we offer a service. It's our CO2-based laser that will help with that. So it's going to help tighten and shrink and basically rejuvenate the cells in your inner vaginal wall, which is awesome because a lot of clinics don't offer that. So we do have something to offer our females. It takes 3 treatments. You can come in every 6 weeks. There's minimal downtime. It's virtually painless.
Okay. Do they have to prepare themselves? How do we see them at the office?
So the only preparation is just I have to review their lab work,
Okay.
their recent gyne lab work from that year, and that's it.
And pap smear results
Yep.
and stuff like that.
The gynecology lab work,
Okay.
basically.
All right.
Yes.
All right. Yes, I know our patients are happy with that treatment.
They are. And all of those patients are actually paired up with our hormone replacement because of the estrogen and the testosterone, which will also help with that. We have supplements for those females that want the extra boost. We have probiotics in office, which everyone should be on a probiotic. We have like a anti-anxiety supplement in the office as well, which females love because everyone gets a little anxious, and that will kind of calm their nerves down.
Mm-hmm.
We also have a lubrication for their to pair with their CO2 treatment.
All right. So we have like a treatment and a product for the.
Yes, so that they can go home feeling like they got the whole entire treatment package, not just a one and done. They know what to do from there. They know what to use at home. They know when to come back for the next treatment.
Perfect.
Yeah.
So Setiba is like a one-stop shop.
Yeah, we do it. We do a lot. We do it all. We have so many treatments. We have products to pair it up with. If we don't have something, we can usually find the equivalent, and it's either the same, like similar, or a little bit better than what they're asking for, which is awesome.
Very good.
Mhm.
What do you think about the plan that we have about moving to a bigger location?
Oh, I'm so excited. I'm super excited. I can't wait. It's going to be more fun.
100%.
Yeah.
Because we offer all the services, but we are adding different.
Yeah. Can you tell us about it, or is it a secret?
I would say because beside of the episodes we are doing here, we are working on our like a mini reality TV show with our producers. So I want her to
Yeah.
show little by little what we are doing in the next
awesome.
8 to 9 months.
Oh,
Yes, but there
fun.
will be a lot of surprises with the new place.
Oh.
You know, of course, you know what's going
Yeah,
on.
I'm excited.
But definitely we share with you guys in a bit.
Yes.
All right. Describe Emilia.
I think you're just a bubble of fun, and you're always happy, even when I feel like that is huge for a clinic owner, in my opinion. I've never met someone that has so much going on and so busy with life, but also one of the happiest and joyful people to be around. Patients love you. Patients ask for you. The clinic would be very different, obviously, if you were not the owner. And I think it's awesome because you bring that spark of life into a med spa wherever you go.
Thank you.
Yeah.
Thank you. Do you like working with us?
Yeah, I love working with you guys. It's amazing. It's fun. It's every day is a new day. Every day I'm learning something new. I'm young, but I always want to be growing. So, and I think you do as well. I feel like you are very successful, but you always want to be growing.
100%.
Which is, yeah.
The keys and what I love about you and admire is not just saying because I have this experience and I'm good at what I do. Always you're on training. You're educating
Yeah.
yourself no matter what. I love that.
Totally. Yeah, it's huge. Every day there's a new thing coming out, or I obviously don't know everything. I don't know half of what I should, like, there's always something new to learn, and always ways to improve a patient's outcome, or just get it that much better, or one little bit better, which is what I want for everyone that comes to Setiba.
That's one of the reasons makes Setiba stand out between other medical spas.
Yeah.
Is having an employee like
Yeah,
you.
well, thank you.
It's amazing.
Yeah. So some other treatments that I think need to be mentioned are our vein removal, our IPL. We have tattoo removal. So we really do everything at Setiba. We can get rid of your unwanted tattoos. We can get rid of your unwanted hair with laser hair removal. We can get rid of those little vessels on your legs, the pesky ones that a lot of females will come up to me and they're like, what are all these little veins? Just get rid of them. Everyone has them. When you go through pregnancy, you'll get even more. So we can get rid of those. We have normal microneedling. We have a lot of peel options, the perfect peel, the VI peels, and the Cosmolon, which is kind of the mega peel for melasma, which I know
Cosmolon is very good. I love it. I
you've
love
done
it.
it,
Yes.
right? And you loved it.
I love it.
Yeah,
The
so
best peel.
yeah, it's amazing for melasma patients. It's going to get rid of that pigmentation and then maintain it down with a at-home product.
Definitely, definitely. One of my favorite pills that we have. Do you combine plasma pen with Morpheus 8?
We do. So we do that a lot often. So if a patient comes in with a lot of loose skin that needs to be basically targeted and shrink or reduced, we'll do a plasma pen first, and then we'll do Morpheus treatments afterwards, which has gotten outstanding results in my opinion.
The result, yes, when we combine
Yeah,
them,
it's like a life-changing result with the plasma pen. When they're a good candidate for the plasma pen, it's very worth it to go that route of plasma pen first and then Morpheus afterwards.
Definitely. And plasma pen, what I love about it, because the downtime is 10 days, but the results are day and night in 10 days.
Completely. The most recent patients that we've treated with plasma pen have knocked my shoes off in regards to their results, right? I'm like, oh my gosh, you look amazing. Like, I can't barely recognize them, honestly. It's like all of their lower face is nice and tight around their eyes, their fine lines and their crow's feet are fully reduced. It's honestly a night and day with plasma pen if they're in a good candidate for it.
Non-surgical treatments.
Yeah.
It's all non-surgical treatments, and you can see the results in 10 days. Very
Which is
good.
awesome.
Very good. So, Quinn, when a patient comes in and we do a consultation, we do a treatment, and after the treatment, what do we recommend them?
So we have post-care. So post-care is huge. I will always give the patient a full review of their post-care. I'll give them a handout of their post-care, which we now have these cute little hand cards with their post-care instructions on them. Explaining what to do right after treatment, and because that's honestly a huge part of the actual treatment is how they take care of their skin afterwards. No makeup for 2 days, no SPF for a day, keep it protected out of the sun, no working out for Botox, no laying down, no working out for a few hours. It's key because if the patient doesn't follow those instructions, it might affect their actual treatment, which is unfortunately not. It's unfortunate because they just paid money for this treatment. I want to see that good result. So I make sure they understand it. We have kits that they go home with often for if they have pigmentation previously, I'll make sure they go home with a brightening post-care kit, or if they need products that I know will enhance their treatment, I will make sure they have the Obagi in their hand or their SPF, or if they need a product they're missing from the regimen, I'll make sure they have the gentle cleanser that they should be using. It's so fundamental to any treatment.
Perfect. So
Yeah.
they will be like well taken care of.
Yes,
when they
that's
leave.
what I want them to feel comfortable getting the treatment afterwards at home. They can always call the office, but I definitely want them when they leave the office to feel comfortable and just confident in their post-care, what they should be doing.
Very good.
Yeah.
Very good. You know, we did a Morpheus 8 for a double chin and the neck and on the back of the neck.
I know, I was going to
Okay.
mention that earlier.
The results are so good
I
that
know.
I received the text last night. She has
Oh.
3 clients with the phone numbers for us.
Awesome.
She sent the
Yay.
information that they are interested.
Oh, that's awesome.
So we did a Morpheus 8 couple of days ago.
Like 3-4 days ago.
3-4 days ago, and right away we took it. We always take a before pictures, and after the treatment we take a picture too. So it's a huge noticeable results on the double chin area that you can see. And usually after the treatment you're swollen, but with the Morpheus 8 you can see the tightening and fat reduction right away, and the result gets better and better. So imagine how happy she is that after a couple of days.
That's awesome. So for fat reduction for Morpheus, you can basically see almost instantly in that first week, which is amazing. People love to get fat reduced on the under chin. That's a common area. To get the tightening and the collagen, so collagen will build up in 30 to 60 days, but some patients will see it beforehand, some a little bit longer. If they're an older patient, I have to preface, your collagen will take 90 days because you're a little bit older, it's a little bit slower, but we'll get there. We're going to see the result, and some people will see it that first week, which is awesome.
I say, as you mentioned, it depends on their skin texture, their age, varies how many treatments they need to do. I would say, what do you think? If they start sooner taking care of their skin,
yes,
the results last longer.
Yes.
And later on, you need to do less treatment to take care of.
Totally. It's very interesting because I can totally tell someone that's been doing treatments since a little bit younger versus the patient that comes to me. They're 65. They've never done a treatment. They need a different plan. They need more Morpheus, or they need more injectables, or they need more. Their plan's a little bit more complex, but we'll get there. It's okay. We'll just, it's a journey. It's a nice, fun journey of just all these different treatments that we can offer them.
Very good. If a 25 years old comes and says, I want to take care of my skin, what treatment do you recommend?
So depending on their skin, honestly. So if they have rosacea, then I'll do an Adva. If they have acne, we'll do a Morpheus. If they need hydration, Diamond Glows are amazing for hydration. If they
have nice skin, but they want to do some treatments to prevent.
So our Morpheus would probably be a preventative treatment, totally. And you can even add PRP to it, which is awesome. It's going to help basically give them a little bit of a rejuvenation, build the collagen a little bit. I mean, if they have nice skin already, they're already pretty tight, no loose skin, it's not hard to get them to where they want to be with Morpheus.
Perfect. Can they do regular microneedling?
Totally. So we offer regular microneedling, a little bit less painful, a little bit slower journey. So they're going to need more of those treatments versus a Morpheus.
Okay.
Yeah.
Very good. Very good. Have you done any of these treatments?
I have. I love these treatments. So we've done a Morpheus. Loved it. I mainly did the Morpheus to see how the pain of the treatment, because I was like, I need to feel what my patients are feeling when I do the treatment. And I don't think it's that bad. So then after that, I was like, let's crank up the
oh my
settings. No, I'm nice to them. And then the Advas are amazing. I love doing Advas.
You mentioned about PRP that we can combine
Yes.
with Morpheus 8. Which part of the body or which other treatment can we do with PRP?
What?
Can we inject like for hair?
Oh, yes. Yes. I was like, is this a trick question? Oh my God. No, so we do hair restoration with PRP injections, which I do often actually. I have definitely a group of patients that come to me for hair restoration. They come every 4 to 6 weeks for it, and
What treatment plan do you do for them for hair loss?
So I'll pair their hair restoration. I'll pair it with hair PRP injections. I'll have them go home with a topical hair serum that they'll put on, which is through Biote, which is their hormone replacement. And then I'll also do hair threads. So it's our threads, a smooth thread that I'll insert in their scalp. It's painless. It's not going very deep, but it's going to stimulate their collagen for up to a year. So that's honestly what I do first. Then I pair it with their injections, and I tell them we have to do multiple of these injections to actually work. You're going to see your hair start to grow in 3 months because it's slow. Hair's very slow to see witness of it, but if they follow the plan, they'll see it starting 3 months, which is great.
Yes, so it's not just one treatment.
No.
When you lose your hair, it's a combination of treatments
Yes.
you need to do.
And I would prefer not to do just one. If someone comes to me and they're like, I can only afford one or I can only do one, I tell them realistically one is not going to get to where you want to be. So we need to do a different route, or we need a plan for this.
Very good. I love it that you're very honest.
Yeah,
And
you have to be, because if you're not if I like to be honest with patients because I do want the best outcome for them. And if they aren't happy, I need to be honest with them if they're not going to get to where they want to go, because we're not going to be happy at the end if I'm not honest with them.
Of course,
Yeah.
of course. It's very important.
Totally.
To be honest with the patient, to do a good consultation with them, and listen to them, what they want.
Yes, huge. Today's episode is brought to you by Upneeq. It is our latest product in office. It's this very cool eye drop, single use, that you put in your eye in the beginning of the day. It lasts 6 to 8 hours and it'll make your eye bigger and brighter. So it'll work on the eyelid and it'll pull it back just a little bit. There's a little prescription in there that will pull back your eyelid and make your eyes bigger. It's so fun. Everyone loves it. It's honestly an awesome product. So if you're interested in it, call our office, call the clinic, and we have boxes of them available.
Of course. Quinn, have you dissolved a lip filler?
Yes, I have done a lot of dissolving for lip filler. So a lot of patients will come in 4 or 5 syringes later with their lips, and that filler will migrate over time. A little bit dependent on the injectable used or the injector, but a lot of it just migrates over time. So I'll dissolve them, start fresh, and they love the results with their lip filler, which is what I want to get to the if they're coming to me and they're like, I just want this to be fixed and I want more lip filler or just more filler in general, I say, let's start fresh. It's moved, it's old, we need to dissolve it to get rid of it completely. It's not going to go away on its own.
Okay. Do you think the pictures that is on social medias, like different, they show a before and after? If someone does not have that lip shape, do you think you can create it the way that they're showing it on Instagram? Does it last like that?
No, it's super hard to create a different lip shape. I have to go based off of the lip that I'm working with, and I tell them that's a realistic goal to set with the patient. Like, yes, we can try to replicate this similar, but it's not going to be completely exactly the same because your lip anatomy is just different.
Okay.
Yeah.
So, when I again in the consultation room, we tell the patients these are the before and after pictures are good, but these are right after the treatment, so the lips is swollen. But if you look at the lip 2 weeks after, it does not look like that.
Completely.
So you cannot compare your lips with the pictures that you're seeing on the Instagram or the different techniques.
Yeah.
What do you think about the IV infusions?
IVs are great. So we offer a variety of vitamins that we can put and kind of give you a little bit of a personalized IV in office. They make you feel better. They make you feel energized, hydration. Patients love to just do them on adding on to their treatment while they're in office, just to get that full clinic kind of spa experience in office.
Of course, it gives you energy.
Yeah.
It gives you energy, and I love the glutathione.
Yes, gives you some energy.
That helps with skin.
Totally.
And it's anti-aging, isn't it?
Yes, it's awesome. Come into Setiba. I'd love to meet you all. I'd love to go over treatments, treatment plans. I look forward to meeting you all, and I'm just excited for what we have to come and what I can do for everyone.
Thank you for joining us today, and you guys can follow us on Instagram, Facebook, and our YouTube channel. And you can mention our podcast to get additional 10% on our treatments. And if you are interested to get a consultation with me or Quinn, you can give us a call at the office, and looking forward to see you guys next week for our next episode.